it's Lauren, and you're listening to Social Workers on Fire. And unfortunately, it's just me here today as Brianna is out sick, but we do have a firefighter, Robbie Davis, with us today. And so I'm going to have Robbie just kind of explain how he got to be a firefighter. What made you want to be a firefighter?
Oh boy, well that's a fun question. I grew up in a small town in South Alabama, and we didn't have a fire or ambulance service that was nearby. It was probably about a 20-30 minute arrival time that you would have to wait for either of those to arrive. And so the local community got together, and my dad was one of these people that was involved, and they started a volunteer fire department. So from an early age as a kid, I was kind of exposed to the fire service in that capacity, but that was not something that I ever considered as a career. I actually left, went to the University of Alabama, studied here for 4 years, kept going to school, and it wasn't until later that I just happened to be looking at the City of Tuscaloosa website and saw a job posting for a firefighter. And of course, what initially drew me in was the fact that they made a little bit more money than I thought that they did at the time. So
Makes sense.
it was something where it was like, you know what, this could be something that I would enjoy doing, and I think that the compensation is enough now that you can make a good living and provide for your family, and it's a good career, and it's very fulfilling. So I'm kind of glad I stumbled across that job posting, but that's kind of how I ended up with the fire department.
Interesting. So I'm curious to know, what was your degree actually in?
I double majored in criminal justice and philosophy, and then I went on to law school and attended law school at the University of Alabama.
Oh, wow.
Passed the bar exam, had a very narrow focus of what I wanted to do, and it was criminal prosecution. And I got some experience doing that for a little while, and then realized that maybe the idea of it was better than the reality.
The actual job. That's a big change, though, to go from law school to now firefighter.
It is, and a lot of people still give me grief about that. But
I bet.
I feel like I made the right choice, and I enjoy what I do. And I think, that at the end of the day, you have to find a career that you get personal satisfaction from. There's different priorities, I guess, for different people, but I've always kind of been drawn to public service, and so it's very fulfilling to be able to help people. And then I enjoy our work schedule as well. We do 24-hour shifts. We're off for 48 hours. It's inconvenient at times when, of course, you miss holidays and birthdays and kids' baseball games and stuff, but I feel like you actually get more time to spend with your family,
To a degree, yeah, I can see it because of the 2 days.
Right. So, I mean, I'm usually on my off days. I get to pick the kids up from the bus stop, and on summers, we get, full days that we get to spend together. So there's a lot of benefits to it.
Yeah, that's awesome. So when you applied, you saw the opening position with the city, you applied, you had no firefighter experience at all at that point?
No real experience.
Okay.
I would tag along with my dad sometimes.
Right, just what you had been exposed to.
On a volunteer level, but it was, a very different experience going from volunteer to a professional.
Yeah. Yeah, okay. So how long have you been here now as a firefighter?
About 9 years.
9 years. And what all stations and roles have you been in while you've been here?
I started off, I was at Station 2, which is our station that covers the University of Alabama campus. And I was there for about 3 months, and then I started EMT school, got moved to Station 9, stayed there for about 3 years until I went to paramedic. And when I got my paramedic license, I moved from being a firefighter on a pumper to being assigned to the rescue truck. And I've been on Rescue 21 for about the past 5.5, 6 years.
Okay. And so for those that are listening that maybe don't know about what all the pumper, the rescue truck, can you kind of explain the difference?
Yeah, and I had this conversation with someone the other day that, they didn't have a lot of knowledge of the fire service. They're like, I just thought a fire truck was a fire truck.
Right.
But we have pumpers, we have ladder trucks, we have rescue trucks, and they all serve a different role. So your pumpers are the ones responsible for your fire suppression. They're the guys that pull the fire hose and they put the fires out. Mm-hmm. And then you have your ladder trucks. Those are obviously the ones that have the big ladder on the top of them. But they deal more with the conducting searches, forcible entries, ventilation, securing utilities. So they've got a different role. And then you have your rescue trucks, which are utilized in different ways in different departments. But in our department, that's 2 paramedics that are on a transport-capable truck, meaning we have a patient care compartment in the back. If needed, we can transport. We typically do not because we have a private ambulance company. But it responds to your higher acuity calls, your ALS calls that require a higher level of care.
Yeah.
In theory.
In theory, yeah. And I know usually when we explain to people outside of it, when you think of a rescue truck here, what you're thinking of is like what you would see an ambulance kind of looking like. It's the box, like you said, has the capability to transport. So that's kind of how we explain it to people is think about your ambulance, that's our rescue truck. And so what Robbie mentioned earlier is that he is on Rescue 21, and here in Tuscaloosa, Rescue 21 is our most popular rescue truck. They're doing typically the most calls throughout the city. And so because of that, Robbie's really gotten to see these what we call frequent flyers or repeat customers, or those calling for things that, as he said, typically rescue trucks supposed to respond to the higher acuity calls, but we actually have an excess of low acuity calls. And so kind of tell them how that affects like your shift, how you're seeing that on Rescue 21.
Yeah, so there's definitely a lot of opportunities to see different types of calls and utilize EMSP. Last year, I don't remember the exact numbers, but I think Rescue 21 made somewhere around 2,500 calls. Wow. And it's really all over the place. We respond to cardiac arrest, car wrecks, shootings, stabbings, but then we also respond to anyone that's complaining of chest pain, difficulty breathing, which can kind of be tricky. When you hear that, it's chest pain supposed to that requires the higher ALS unit. You normally would refer to that as like cardiac chest pain.
Right, you're about to have a heart attack, something serious is going on.
But sometimes that distinction's not made. Sometimes you have someone, maybe they have the flu and they've got just body aches and their whole body hurts, but they answer, yes, I'm having chest pain, and so you get that higher level response. But there's been a lot of times that you have people that they call 911 and they'll answer yes to just whatever questions. Dispatch tries to filter out to send the appropriate response, but you have to rely on the information that you're given, which isn't always the most accurate information. That you'll show up and you'll have people, and maybe once you get there and you start asking questions, you find out that really they're just homeless. They need somewhere to go. Maybe they're just hungry and want to go to the hospital so they can get something to eat. There's one lady, she will call. She lives in a small apartment with her grandkids, and it took forever to get this out of her, but she finally admitted that her grandkids will get on her nerves and she just needs to get out of the house, and so she calls 911 and leaves an ambulance to kind of give her some peace of mind.
And it's so funny when I talk to people about what I do and what we do, and I tell them the type of calls we get and stuff like you're describing there, and it just blows people's minds, like, people are really calling 911 for that. I'm like, yes, they are. And I know I've seen too where there's calls and y'all come in, lights and sirens because it's chest pain. And then you get there and like you said, you're asking the questions. They're like, oh no, my stomach just hurts, but they told dispatch, oh, I've got chest pain, and so you're flying in like a heart attack's happening.
That's right. You just
Yeah.
you make the best decisions that you can with the information that you have in front of you.
Yeah.
And obviously we're going to err on the side of caution
Yeah.
and make sure we respond appropriately if it were a true life-threatening emergency. But sometimes it's just a little different once you get there and start asking questions
Yes.
that go a little bit more in depth.
So tell us about, like, before EMS prevention, what happened with these calls. You go and they're frequently calling for the same thing, or you go and they don't realize this isn't something you call 911 for. There's other ways to handle it. What could y'all do at that point?
Well, there wasn't a lot we could do. Some of it was that even if there were resources out there, we weren't familiar with those resources, or we didn't know how to connect these people with the other people that could help them. As paramedics, as firefighters, we're trained in emergency medicine, and kind of the analogy that I would give is if you went into a doctor's appointment and you had an appointment with an oncologist, and you get there, and when you get to that appointment, you start talking about hey, I think I have a cavity. Every time I drink something hot or cold, like my tooth hurts, like what can you do for that? And it's like, well, you need to go see a dentist. I'm a cancer doctor.
Right, yeah.
And so we like to help people, but sometimes we don't know the resources that are available because of the nature of our job being emergency medicine.
Mm-hmm.
We don't know some of the nonprofit agencies that are out there and some of the social work type things that y'all are well connected with. So now that we have EMSP, we can kind of put them in touch with people that can provide for them whatever their need may be. I don't know if you were even here at the time, but one of the first calls I remember referring someone to EMSP, there was a lady who had high blood pressure, and she would call because she started feeling dizzy, lightheaded, short of breath, all those things associated with uncontrolled hypertension. And we would ask her, well, why aren't you taking your medication? Like you have blood pressure medication, what's the reason you're not taking it? And her answer was, I don't have anybody to take me to the pharmacy. Somebody was supposed to come, a few days ago, and they never showed up, and I don't have a way to get there. And that's something that I referred to y'all, and y'all were able to help her with that. And so now that we have y'all to kind of step in, because our role, we show up, we help them right there as much as we can, but ultimately once they get in the ambulance, they go to the hospital.
You're done until the next call comes.
Correct.
Yeah. And I think, kind of touching on what you were saying earlier about that one specific woman, is when she's calling 911, like, it is an emergency at this point for her or for some of the other clients, but there was ways to prevent it from ever getting to that point, and she just didn't know how to. So yes, they may be calling for a true emergency, but there was something that could have been done before it ever got there, So are you now that EMS Prevention's here, what kind of difference are you seeing, like, in the calls you're going on in your day-to-day basis when you're on shift?
Well, it's a big difference. I think in one of the previous podcasts, Chief Holloway referenced that about 90% of the people that are referred to EMSP benefits from this service, and we see, kind of a reduction in them relying on 911 and relying on, the emergency services side of what we offer. Because y'all are able to connect them to those appropriate resources. So once we identify a need, and once we realize that there's someone that has a non-acute type condition, and sometimes it's not even non-acute, it's if you call for high blood pressure, that is something that can be a life-threatening emergency. And that would be, another point that I would like to emphasize. I think people think of EMSP initially as a service that helps reduce 911 abuse, that deals with, non-acute things. But at the end of the day, I think y'all are impacting people's lives and saving people's lives. You go about doing it in a different way than what we do as paramedics. But take that patient I referred that had the, uncontrolled hypertension. We all know that if you don't treat high blood pressure, it can lead to an increased risk of heart attacks, of strokes. Mm-hmm. And so by stepping in and helping her get the medication to treat that condition, I mean, essentially you could have saved her life. I mean, that could have been, a person that several weeks, if it would have gone by, that they would have suffered a life-threatening event, whether it was a heart attack or a stroke. So there are ways that y'all impact the people that you serve that I think is just as important as what we do. You do it from a different approach.
Right, a different angle. Yeah. Well, I appreciate that. So I think when people think about 911 calls, they're thinking of people in accidents, like you said, or people in their homes and they're having an emergency. But you guys are also responding on homeless clients or people in unsuitable housing, right? Condemned houses. Could you tell me a little bit about those calls?
Yeah, and that's one thing that we see, a lot of. You respond to a call, and it's either they're completely homeless, they don't have anywhere to go, and we just kind of send them to the hospital, hope that maybe at the hospital they got connected to the resources there. But now that we have the option to get their information and get that to y'all, we can connect them to EMSP, and y'all can get involved to help either find housing or find a shelter, and reach out and kind of facilitate, getting them in a better situation. There's also times, and I've referred, people to y'all for this as well, where you show up to a house and the living conditions are just deplorable.
Yeah.
And maybe that's not even why we get called. Maybe we get called for some sort of medical emergency, but once we're there, you notice that, maybe they don't have electricity, or maybe it's the dead of winter and there's holes in the wall. They're, patched up with a piece of poster board, and it's just not a good environment, especially if, you see that there's kids involved, and then, you can kind of facilitate DHR being involved if you need to. But there's an easy way, whereas before, it was a lot more difficult to navigate in terms of knowing where to refer these people and how to help them and how to improve their situation, because that's not, something that we were familiar with all of the resources. But now we can kind of refer them to y'all, and y'all can put them in touch with someone that can help them.
Yeah, and I know I've gotten referrals from you guys, of course, like you're saying, for people in these conditions. And I think what's so great is, like you said, you guys really care about these people, but you're not trained in that. You don't know what to do to get them the help they need. And so I love when we can get referrals like that, and the guys are able to follow up on the referrals they send to us. And so it may be someone they're really concerned about, and they're able to call us or pop in the office like, hey, I referred this person, what's going on now? And to be able to tell y'all, hey, they're in housing, or hey, they're out of that situation and here's what's going on. I think that's rewarding for both sides. You know that you played a role in getting them out of that, So, and another thing is that we talked about earlier in the other podcast that we see all of our clients in the home. And so when we do get referred to clients with no housing, again, we still do not make them come to us, whether it's going to a gas station, a restaurant, a park. We're going to meet them wherever they're at and just work with them to break down those barriers and get them the help they needed. And that's just one thing I love about this program. So Well, Robbie, I so appreciate you coming and being on with us today and doing this podcast.
Hey, I was happy to be here. I'm a big fan of EMSP, and one of the big things that I appreciate about y'all is y'all help to identify some of these root causes, and you kind of get down to the base of the problem and solve it from there. So, I mean, it's a logical extension of what we're here for. We're here to help people, and now we have another tool in the toolbox, so to speak, that we can utilize in order to do that.
Yes. So, for our next podcast, we are going to bring Dr. Crawford on as a guest speaker, and he is actually the state medical director. And so, we're going to hear his perspective on EMS prevention and what he's seen in his role.